Welcome to the Beach Chair, where we talk about anything under the beautiful sun of Livi Eusebio. From food, wellness, art, surfing, the community, and the people that make La Union a dream destination. Okay, so I'm really excited with today's episode. We're very honored because, I have a lot of doctor friends and super busy nila. I'm really happy na we have Doc Ilian and Dr. today to share their story, their La Union story. Actually, welcome to the show, Doc Ilian. Woo! Big team. So, I want people to know muna, kasi parang di ba when you're a doctor, meron kasi ako funny anecdote na I have a lot of doctor friends na every time may emergency, parang ayaw nilang pinapa-volunteer na doctor sila. Parang especially when you're traveling, when you're on the plane, when you're on the vacation. Kasi parang with the idea na iba-iba yung specialization, di ba? Doctor. So let's start with that. So what's your specialization, doctor?
For me, I am an orthopedic surgeon primarily, so I deal with bones and joints. I subspecialize in sports medicine and arthroscopy. So I handle sports injuries, joint injuries from sports, and I do yeah. And I do all the reconstructions needed. So if you've heard of like the most common is the ACL injuries, and so that's my subspecialty. I also do shoulder injuries as well.
Okay.
Yep.
Me naman, I'm an ENT. So, ears, nose, throat. Any general ENT yung practice ko, but I did subspecialize in ear stuff. So, ear surgery, mga ganon.
Okay. I'm really curious kasi last time we saw each other, Doc Lee, we're in UP.
Yes.
Diba? Tapos ako, parang, okay, you're here.
Oo.
Back then, you're not from here, right?
No.
Okay, you're not Ilocanos.
No.
Okay, you're originally from Manila. That's Sama. And then now you live here.
Yeah.
You're based here.
Full-time.
So parang what made you decide to practice here in La Union?
Well, the story starts.
Yeah. I think it was the pandemic for the most part that kind of made us rethink the kind of life that we want.
Before the pandemic, both of you are already practicing in Manila.
Yeah, we both had our practice in Manila.
Like make hospital or you up here?
Yeah, we had our clinics, we had our Manila-based clinics. I think we were practicing for mga 5 years na rin in Manila, so we had our patient base naman. But then the pandemic hit, and we're both outdoorsy people kasi. Like I've been surfing since 2009. And then we both enjoy hiking, biking. And then during the pandemic, lockdown, diba? So we were just really stuck in the condo, and it was...
Especially working in hospital.
And then, yeah. Oo.
Could have been a crazy experience.
Yeah.
Okay.
So yun. And then when we finally were able to go out, we first went to La Union. We stayed 3 weeks here. And then it was so refreshing for us. And then Ilian was like, tanong natin kung pwede tayo magtrabaho dito. Ganun lang.
Okay, so talagang no intention. You came here, you wanted to escape.
Yes.
And then, after experiencing 3 weeks talaga.
3 weeks agad.
So, after that 3 weeks, consider nyo moving to La Union. How did you have to ask for clinics or?
Yeah, well, fortunately, the first one who was here was actually Dr. J. Esperon. He's been our friend since the PGH days. We trained in PGH.
But you're not batchmate?
We're not batchmates, but we trained at about the same time.
Okay.
And then he was here since, I think, 2017.
Yeah.
He's been here since 2017, and he has been saying that there are no practicing sports orthopedic surgeons here in La Union at that time. But we never really considered it as a serious option at that time. But as Liv mentioned, during the pandemic, so we reached out to him, and fortunately, I also knew some of the orthopedic surgeons working at ITRMC, the regional hospital here.
Yes. Yeah.
So they're based in Dagupan, but they work at ITRMC. So during that time that we were here, I reached out to them. We actually drove to Dagupan.
Yeah, to meet.
To meet with them. And told them that I am interested in joining their department, ITRMC. Is there an opening? It's as simple as that. Probably you can say we just, shooting your shot. And then fortunately, there was an opening. And he said, and all my friend said was, are you willing to move here? So we had a couple of days to think about it. And the rest is history.
Yeah.
In that time, when they says yes.
Yeah, we were surprised.
It's familiar kasi example, they have pathologists said
Yeah.
na parang meron siyang Clark, meron siyang Lucena, meron siyang every day in a week you go to one place,
Yeah.
meron for sa Pasig, and actually that's it, no?
Yeah.
They're based in Dagupan and then they do clinic once or twice a week and then pipila lahat ng mga tao on that day.
Yeah, yeah.
So, after that, parang both of you decided na, sige, you'll leave your practice. Did you leave your practice in Manila?
Yeah, initially we were thinking na maybe we can do parang hybrid first. Kasi like when you're a doctor, you really need to build your patient base eh. So we were thinking maybe we can do hybrid like 3 days in Manila and then the rest. Pero parang ang hirap. So what happened was, like ako, I did like online work first. And then he got a position sa government hospital. So at least we had like basic income that would, that would support us. Para okay, may pang rent tayo, may pang kain tayo. Sige, yung building the patient pool, hopefully dumating na lang.
With Valos. It's a ton of para nakakatawa. As you can saying, I have a lot of doctor friends, so alam na ano pa yung situation nyo. Na parang, oh my God, if you're not inheriting a practice,
Yeah.
hirap talaga. Especially, tama, you're married, right?
Yes.
You're a couple and then mag-start ng family and then you're going to move tapos in a different speaking region.
Oo.
But now, okay na. Would you say okay na yung
I would say actually we're very lucky with what happened here in La Union. Because there was really a niche for us, for both of us. Actually.
there was a demand?
There was a demand. There was a place for us, and we were welcomed here by the medical community.
Yeah, actually that's a big
That's a big plus because it doesn't happen all the time. But for us, we were fortunate enough to be welcomed here. So our practice really got into the flow pretty easy, I would say. So we're very lucky with that. And now, we have a steady patient base. It's slowly growing, and then it supplements our income from the training hospital, the government hospital.
I'm just curious, what did your family say when you say, okay, by Manila, we're going to La Union?
Ang sabi,
Especially yung mga relatives nyo, parang, kailangan ko ng ganito. Especially, alam mo yan, pag doctor
Yeah.
What were their reaction when you said you're going to move to La Union?
yung mom mo was like at least in the Philippines and not like abroad. Then my mom naman was doctor kasi yung mom ko eh. So she was like, pakiramdaman niyo muna yung professional climate kung kamusta. Sabi niya. And then when then we were fortunate enough nga na they were very welcoming. Okay na, parang na-assure naman siya na it was
Okay na. But parang when I was saying because I was telling you earlier, parang this is the first time we formally met.
Yes.
So, remember, you always see each other because I know Liv,
Yeah.
and the last time I saw her nga was in college and then I see her around without knowing na she would here na pala until that accident. Na parang, all my friends' accident. Na parang, okay, dito na pala si Liv.
Yeah.
So, parang she with text messages and then realizing it afterwards na parang that was very unprofessional. Parang sending you messages on IG. Parang, my friend needs help, blah, blah, blah. So, when I checked, grabe yung clinic mo. So, nakita ko parang meron ka sa Norma, meron sa Bethany, meron sa
Dagupan times. Yeah.
You have enhanced.
Yes.
Yeah.
So, I'm just curious, Doc Ilian, madami na ba mga surfers na nag-cover?
Well, yes. Surfers, yes. But majority actually of the patients that I am handled here are from La Union. They are La Union as a province is very sports oriented. The people here are sports oriented. I find that they're very active. They love outdoor activities. And a lot of the locals have had sports injuries, especially coming out of the pandemic. People they didn't do any activity for the longest time, and then suddenly when everything opened up, basketball silang lahat. So lahat, yeah. So basketball is still the number one sport, I would say, here in La Union, and then probably, I don't get as much surfing injuries yet. Hopefully not din naman. Thankfully then. But yeah, in general, there are a lot of active people here of all ages, and I'm pleasantly surprised that that is the general outlook of the population. They're so into sports and being healthy.
Parang I remember when I was really into surfing, parang every now and then, lagi ako may infected ear.
Yeah. Oh, meron.
Is it really
What I get is ear infections and fungal infections of the ear.
Galing daw sa merit.
Galing. Yes. Parang the patients I've had who have like mga ear infections, they all say, nag-surf kasi ako sa kanila.
And you think, ano talaga, that's related? You think, talaga?
Partly, could
Possibly.
Could be, oo.
Possibly.
But yeah.
So, how many years have you been here? Is it years or months?
Years, 1.5.
1.5. We moved January 2022.
Okay, that's a year.
Yeah, we started January.
Okay, so, para in the last 2 years, would you consider na this is it? I'm going to build my family here. I'm going to be based here.
Yeah.
I'm not going back to Manila anymore. Yeah.
Yeah.
I think definitely yes. I think we've felt that we've been welcomed here. Then yun nga, the medical community has been welcoming and very, very supportive. They have actually great doctors around here, especially, the hospitals here are top class. So we can compare them to the hospitals in Manila.
Actually, Lorma's very
Yeah, Lorma is actually very good. They're very competitive with similar hospitals in Manila. So they have the same. So we can really build our practice here. This is a great place to start a family. La Union is a great place. Education, there's also very good schools that are available here, and then the people here, the community is very welcoming as well.
Any instance na meron language barrier, like for example with your
For the most part, I think most of the people of La Union speak and understand Tagalog pretty well. They can. I think the exception may be those in the really, far-flung areas of La Union, in the mountainous regions. They have difficulty, but they can communicate.
Okay.
So language barrier-wise, I haven't felt really that, it's not like you're speaking completely different, like Japanese or Korean, something like that.
Yeah, and translate talaga the whole side. So, parang, yung idea na parang, oh my God, I'm talking to a professional and we have to use Google.
Yes.
Para magkayos.
So nothing like that. But now we're trying to learn din naman the Ilocano language. It's just a little difficult because we weren't exposed that much. So we have to relearn it. But we can, in the 1.5 years of practice, we can understand a few words.
With the demand, diba? Na you said, parang surprisingly, there's a huge demand. And when you moved here, the idea is you wanted to escape Manila, you wanted to be outdoor. You still have time to surf, to go out, to hike.
We make time actually. Yeah, we make time. Like, of course, when we first moved, and wala pa kami masyadong patient, so ang dami naming oras, diba? Pero ngayon, like we're getting, more patients now, but we make time to surf. Kasi it's the reason we moved din it's not just, for the practice. We really wanted that balance. Kasi we didn't have that in Manila Like kumbaga yung time mo in Manila that you're stuck in traffic, here we spend it surfing, or we're very fortunate to have that, pero we make time.
So you live in San Juan or in San Fernando?
San Juan.
In San Juan here. Any last word? I don't know, doctors? Kasi I think madami pang walang doctor dito. Para alam ko walang maayos na cardio.
Marami.
We're just really happy, parang I'm meeting a lot of doctors, especially when I got into running. Nagulat ako na may mga doctors talaga from Manila na kino-consider yung ITRMC will be weird practicing here. Na living Manila na given na all their lives na din sila. So, what do you wanna say?
Liv, you can go ahead. Go ahead.
Would you encourage them to move here?
Yeah. I mean, I think it's really, first siguro is like really determining like what kind of practice and life that you want. I think for everybody, that's what the pandemic sort of made us, really realize eh. Parang ito ba yung buhay na gusto ko, or do I want something more, better quality and stuff. And then I guess if there are opportunities, maybe it's good to explore then. But at the same time, papakiramdaman mo rin syempre yung the community you're entering. Kumbaga, you don't just, go in there and say this is how it's done. Kumbaga, you parang pakikisama ba and get the feel. I think that's important. But yeah, I mean, why not?
For me, I think, as doctors, you really need to go to the areas that are underserved. There's a lot of areas like that still in the Philippines, especially in the provinces, Urbanization is centered pa rin, Manila-centric pa rin naman kasi, So, especially for the subspecialists like us, everything is found in Manila pa rin. But we're trying to change that. I think the younger generation of doctors are seeing that, going back to my province or going to another province and actually just practicing there and serving the people there is rewarding enough din naman. So I think there are opportunities not only in La Union but other provinces, and I think I do encourage younger doctors to look outside their comfort zone and see, kasi that's exactly what we did. We just went outside our comfort zone, and you'll never know until you try.
Yeah.
So we're here. We were lucky, and luck plays a big part, I know. But if you don't take the first step, then nothing's gonna happen, right? So I think I do encourage them to try to get out of the box.
Yeah. Thanks for making time.
Thanks so
Thank you, Rafi.
Thank you.
Yeah. Okay, so thanks for tuning in today. We really added good conversations na butan kami past sunset. Thanks for tuning in. Don't forget to follow, subscribe our social media pages, ALPAS Na Union, ALPAS Short, ALPAS TV, Facebook, Instagram, YouTube. Come visit ALPAS Na Union in Baclotan, ALPAS Surigao. We'll always reserve a seat for you. See you next time at the beach.